Why do some people have sudden cardiac arrest in their families? Why do some people have obesity running in their family members? Why do some people have high cholesterol level even though they are fit and thin? Well, all these disorders point towards an entity known as hyperlipidemias. Welcome to this episode of Hyperlipidemias, where we will see exactly why these diseases occur, what subtle skin features help us detect them, and how it can be managed. Hyperlipidemias are a genetic disease which runs in the family, which are caused due to genetic defect in lipid metabolism. Clear understanding of how the lipids are digested and absorbed in our body is necessary to understand why these hyperlipidemias occur. I have added the link in the description below, where I have explained in detail about the pathway. So do watch that video before you proceed further. Dyslipidemia is a combination of two words, dys and lipidemia. The word dys means abnormal and lipid means the fat. Basically, dyslipidemia has been classified into two forms, primary and secondary. The primary is inherited as a genetic form, whereas secondary is an acquired one. WHO has classified the hyperlipidemias into 5 types based upon the type of cholesterol which is elevated in our body. Whenever we do a blood test in our laboratory, lipid profile shows 5 values. They are HDL, VLDL, IDL, LDL and total cholesterol. Based upon which entity is elevated, we'll be able to classify hyperlipidemias into 5 types.
So basically, according to WHO, there are 5 types of hyperlipidemias. Type 1, Type 4 and Type 5 are classified as hypertriglyceridemia. Type 2 comes under hypercholesterolemia and Type 3 comes under familial dys-beta-lipoproteinemia. Hypertriglyceridemia, usually there will be defect in lipoprotein lipase enzyme or Apo C-II. In familial hypercholesterolemia, there will be defect in LDL receptor, and in familial dys-beta-lipoproteinemia, there will be defect in Apo E. So when we will see how this defect occurs in the pathway. So as you all remember, this is how the triglycerides come to the stomach. From the stomach they are digested and finally come into the intestinal cells. From the intestinal cells, the chylomicron reaches the blood. Here you can see an enzyme called as lipoprotein lipase. This lipoprotein lipase is responsible for breakdown of the chylomicron. There is defect in the lipoprotein lipase. It leads to a disease called as hypertriglyceridemia. And this hypertriglyceridemia patients will present with features of xanthomas. Either lipoprotein lipase or Apo C-II deficiency will lead to the development of hypertriglyceridemia. The patients with hypertriglyceridemia will present with features of xanthomas. Next is LDL receptor. LDL, which is formed here, needs to be taken up back by the liver. For this process, there needs to be presence of proper LDL receptor activity. If this LDL receptor activity is defective, it will lead to the formation of hypercholesterolemia. The patients with hypercholesterolemia will present with features of plain xanthoma, also called as Xanthelasma or Tendon xanthomas. After the breakdown of chylomicron by lipoprotein lipase, the remaining chylomicron is called as remnant chylomicron. It will be left with Apo E. This Apo E is taken back by the liver with the help of Apo E receptor. If this Apo E receptor is defective, then it will lead to type 3 hyperlipidemias called as familial dys-beta-lipoproteinemia, where they will present with tuberous and xanthomas. This is a picture of xanthoma. This is a picture of plain xanthoma or xanthalesma, and this is a picture of tuberous and xanthomas.
With just the clinical knowledge, we can't say with 100% accuracy that which type of hyperlipidemias is caused by which clinical feature. We need to look into the blood investigations to correctly identify and other investigations also. When we do a lipid profile, we'll get to know clearly what's the picture. Once we get to know the exact diagnosis, we need to treat with bile acid lipid lowering agents such as bile acid sequestrants, statins, nicotinic acid derivatives or fibrates. Along with this, we need to incorporate surgical methods to treat the superficial.